It's calcium, omega-3 fatty acid, DHA supplements, trifolic acid, which they need to take along with iron and folic acid. Calcium, see, women has to take calcium in their diet, but calcium and iron should never be taken simultaneously or continuously. Nutrition is also very important, like you should have vitamin C, a good amount of vitamin C in your diet, which usually we prescribe along with iron tablets. Vitamin C, then zinc, collagen boosters, they can help in preventing stretch marks in pregnancy. So Lamaze sessions, what do is that they help you prepare mentally, meditation along with yoga, mental preparation along with physical preparation. For the entire birth journey, you have to be prepared mentally. Along with that physical preparation, which we teach through partner exercises. Partner exercises are a must. Ball exercises, duck walking, these all help in normal delivery of the fetus.
Hi everyone, and welcome back to another episode of TebyNedy Podcast, where trusted doctors help simplify the beautiful journey of motherhood. One conversation at a time. I am Ishpreet, and today we will be diving into a very beautiful yet chaotic chapter in a woman's life, the pregnancy. Joining us today is Dr. Prerna Tayal, a gold medalist from Lady Hardinge Medical College, an accomplished obstetrician and gynecologist with over 7 years of experience into infertility, high-risk pregnancies, and advanced procedures. She's previously been a part of Cloudnine and Artemis Hospital, two of the most renowned maternity care centers in India. She's right now a senior consultant at Indrishila Hospital. So today with Dr. Prerna, we will be answering from the early days of pregnancy to that of the last trimester questions and doubts about baby movements and baby growth. And how should you prepare for your pregnancy? How should you prepare for your delivery towards the last leg of it? So grab a cup of tea and let's deep dive into the questions one at a time, trimester by trimester, with Dr. Prerna Tayal.
Hi Ishpreet. So thank you for the opportunity for calling me here for this great session, which I'm looking forward. And so looking forward for the discussion ahead.
So Dr. Prerna, let's start with the very beginning, the first trimester, the most exciting times, and also the start of the basic doubts where mothers start Googling the most basic doubts ever. So we'll start with the very basic, the most common question, which is, what should a mother be eating during the first trimester for a healthy pregnancy?
Yeah. So in the first trimester, a mother should always have a balanced diet. With the balanced diet, I mean the diet should contain an equal amount of protein, carbohydrates, fatty acids, vitamins and minerals. So in the diet, which we include, it should have a good amount of folic acid, DHA, which is very important for the brain development of the baby. Since in the first trimester, women tend to have morning sickness and vomiting, tendency of vomiting. So they should take frequent meals, but in a small portion. Frequent and small portion meal would do for them, along with a balanced diet.
So as you said, a lot of DHA, folic acid, carbohydrates. What are the few foods that you recommend for these particular?
Yeah. So when we go with proteins, so they should take sprouts in their diet, inculcate. They can include, in case they are non-vegetarian, they can include eggs, meat. Meat should be thoroughly cooked. It should not be raw in their diet. They can eat lentils, a good amount of lentils, soya bean, paneer. They should include in their diet, especially in the morning. They can have coconut water. Then milk should be included 2 to 3 times in a day for a healthy diet in a pregnant female.
Once the food part is sorted, the next thing that mothers go to is the supplements. As you said, folic acid, DHA, all these things are very important to be taken in the diet. So the biggest questions that most mothers end up Googling is, how should they consume folic acid and iron supplements trimester by trimester if we have to submit?
So folic acid is started right away from the first trimester onwards. It's better if they take it from prenatal as well, 3 months prior to they conceive. Folic acid can be taken any time of the day. irrespective of meals. But iron is a very specific medicine. It's usually started from the second trimester because it tends to increase the tendency of vomiting in women. So it should be taken ideally empty stomach. But in case the female is not able to take it empty stomach, she can take it after meals, 2 hours after meals. There should be basically a gap with the meals, 2 hours post meals and 1 hour prior to meal. They should take iron. Folic acid can be taken any time of the day. So when we are talking about folic acid and iron, it's not just folic acid and iron that a mother needs to take through the journey of pregnancy. It's calcium, omega-3 fatty acid, DHA supplements, trifolic acid, which they need to take along with iron and folic acid. Calcium, see, women has to take calcium in their diet, but calcium and iron should never be taken simultaneously or continuously. If they're taking iron in morning, they should take calcium in night. If they're taking calcium in morning, then they should take iron in night. It's the way that we go through. Other supplements like omega-3 fatty acid, vitamin D, they can take any time of the day. Vitamin D preferably should be taken along with milk and taken once a week.
As you said that omega-3, calcium, vitamin D, these are also the necessary supplements. Do these need to begin alongside iron in the first trimester and need to go in the overall journey of all the 3 trimesters,
Yes.
or how should it be divided?
So in the first trimester, we start on the pregnant female on folic acid, vitamin D supplements, omega-3 fatty acids, which are very important for the brain development and the organ development of the child. Once the female settles on with her morning sickness and vomiting, then she can start taking iron supplements and calcium from second trimester onwards. It's the time when the body of a female requires iron and calcium supplements more. So that's the right time to start on with iron and calcium.
Speaking of staying healthy,
Yeah.
one thing that's most female are confused about during their pregnancy, whether they should rest more or they should be more active. So we'll talk about movement specifically in all the 3 trimesters. Is it safe to do yoga or exercise in all the 3 trimesters? And if yes, how exactly should a new mother be considering it?
Yeah. So a light amount of prenatal exercise and light yoga is always safe in pregnancy. Only one contraindication is there towards exercise and movement is that in case they have bleeding or they have a low-lying placenta. In that case, we avoid prenatal yoga or any exercise or walking or body movements. In that case, we advise bed rest. Otherwise, for all the women who are carrying a normal baby, a healthy pregnancy, prenatal yoga is rather advised. They should always do prenatal yoga and exercise because it helps in the normal delivery in future of these women. And they will help in laxening of the ligaments in their body. Then they will reduce the stress also. In the first trimester, females usually tend to have a lot of stress and a lot of fatigue. So it helps the women to overcome the fatigue which she's experiencing in the first trimester. Second and third trimester, exercise and yoga will help in loosening up of the ligaments and help her in the delivery process.
When it comes to exercise, what kind of, is there any specific like light or moderately or some heavy weights? What exactly would we specify?
Yeah. So when it comes to exercise, you cannot do heavy weightlifting. Heavy weightlifting is definitely a no whenever a female is pregnant. Only light exercises, mild yoga like Surya Namaskar you can do. You should avoid those exercises which are increasing the lower abdominal pressure, basically. Upper body exercises you can do walking, normal walk you can do Surya Namaskars. That's what is usually prescribed.
So now we move ahead. Before we move ahead to the next pregnancy timeline, there's one last question that every expecting mother is worried about: the stretch marks.
Yeah.
What exactly stretch marks are, and can these be prevented early on? What's your take?
Yeah. So stretch marks is what in common language we say they are the beauty marks of pregnancy. And they come up because of the laxity of the skin, stretching of the skin, and they are basically the stretch of the elastic fibers in the skin. So which we call as stria gravidarum in our medical practice. But these stretch marks can definitely be prevented. So how we can go about preventing these is that a good amount of moisturization is at most for the skin. You can apply coconut oil, you can apply a lot of moisturizers are available in the market right now. You can apply anything which keeps your skin hydrated to avoid the stretch in the elastic fibers of your skin. Then along with moisturization, a good amount of nourishment. Nutrition is also very important. Like you should have vitamin C, a good amount of vitamin C in your diet, which usually we prescribe along with iron tablets. Vitamin C, then zinc, collagen boosters. They can help in preventing stretch marks in pregnancy.
You mentioned collagen. So
Yeah.
how exactly should collagen be consumed?
So collagen is present in the supplements which we give in the form of tablets, in the form of medicines which we give. Collagen part is covered in those supplements that you should take daily. If you are taking it daily, then this stretch marks can definitely be avoided. But in case you have stretch marks, then don't worry. So once you have delivered the baby and you're fit for doing now exercises and yoga and gymming and all, the stretch marks usually they fade up gradually with time, and you maintain moisturization and adequate nourishment.
Now that we have covered the basics in the first trimester, we'll move towards the second leg of the journey, which mothers face is the baby growth and movements. When the baby starts communicating with mothers in its own, either her own tiny ways, that's where a plethora of doubts arises.
Yeah.
The fresh doubts which lead to how is my baby growing. So I've heard a lot of mothers asking, how do I know whether my baby is growing well?
So, growth of the baby can be determined primarily when you visit to the doctors regularly. They assess your abdomen, the abdominal girth. Abdominal girth is the measurement of the circumference of the abdomen and the height of the uterus, which you are gaining as per the frequent visits. Like every 4 weekly, usually in the first trimester, then every 2 weekly in the next trimester, how the uterus is growing from down to upwards and upwards and upwards. So, usually we have in our mind the weeks, like about when the baby is 20 weeks old, the uterus should be around umbilicus. That's what the ideal growth of the baby should be. In case the growth is less, so the uterus height will not be reaching to the umbilicus, so that will be a lower side. One step is the clinical examination. First is the clinical examination, which is the best guidance towards assessment of the growth of the baby, whether the baby is growing adequately or it is overgrowing or it is undergrowing. Undergrowth is there. Second is by the ultrasounds. So the growth of the baby can be determined by the serial ultrasounds. Ultrasounds which we usually prescribe is the OBS, fetal growth and well-being, along with the Dopplers. So what in the ultrasound we see is the various parameters of the baby, like the head circumference of the baby, the biparietal diameter of the baby, the length of the legs, the bone of the legs of the baby, then the abdominal circumference of the baby. These 4 parameters are the utmost for determining the weight of the baby. So the weight of the baby then is plotted on the graphs, and according to the graphs, we see on which centile the weight of the baby is lying. In case the weight of the baby is less than the 10th centile, then we say the baby is undergrowth. And then we need to increase the supplements, we need to increase the amino acids in the diet of the mother, we need to increase, we might need to admit the mother and then give a drip for improving the nourishment of the baby. And along with that is one more parameter which I mentioned in the ultrasound is the Dopplers. So in Dopplers, we see the blood flow from the mother's body to the fetus. We see how much amount of blood is going into the fetus body, and how much amount of blood is circulating to the brain of the baby. Then there are uterine arteries also. Uterine arteries, we see the blood flow in the uterine arteries. Then we see the ratio. It's basically the ratio which is the most important for us. In case the cerebroplacental ratio is the term which we monitor. In case the cerebroplacental ratio is more than 1, then the baby is fine. In case it's less than 1, then we again need to increase the supplements. We need to monitor the baby frequently. We need to call the women on more frequent visits. Clinical examination has to be done more frequently. Weight assessment of the female has to be done more frequently. These all parameters are the ones which we need to monitor the growth of the baby.
So this was clinical way of analyzing how does a baby growth looks like. Whereas our audience might like to understand from you that what are the signs that a mother can feel on her own that the baby is growing particularly well inside the belly, the baby movements are healthy. What are the signs that she can feel on a regular day-to-day basis while being with her own and with the baby?
Yeah. So when it comes to a mother, how can a mother perceive the growth of the baby is all right or not? First sign is the weight of the mother. Gain in the weight of the mother should be adequate. Whenever we are assessing the mother every 4 weekly, the mother should see what is the weight gain. If the weight is increasing, then the baby is definitely fine. The point is that the weight should never be on a decreasing mode. If the weight is on a decreasing mode, then it is cumbersome, and then we need to see in peep-in what is the growth of the baby. Next is the clinical assessment by a doctor. Third comes, which is most important for a mother, is the movement of the baby. If the mother is perceiving more than 10 movements in 24 hours timeline, then the baby movement and the baby growth is definitely fine. So how can she assess a movement is that once she has her meals, then after meals she lies in left lateral position, and then she assesses and counts the movement of a baby. In case the baby has 3 to 4 movements post meals in one go, then the movements are fine, and that means the baby is absolutely fine. This method applies till the third trimester, right till her before her delivery. If she is counting the movements like 10 to 12 movements in first 24 hours, then you can say that the baby is fine and the growth is fine. Then comes the weight gain, and then comes the serial ultrasounds. In serial ultrasounds, we can assess how the weight of the baby is increasing in serial scans, because in scans we come to know about the weight. Like in level 2, it is 280 grams, then it comes to 1 kg, then it comes to 2 kg, then at the time of delivery it should be 2.5 to 2.8 as per the Indian population. So that is what we see, and we can say the growth is fine.
You mentioned weight gain in mother. So one parameter that a mother shouldn't be checking the weight every day or maybe every second day. What is the ideal frequency in which mother should be assessing this weight gain?
Yeah. So weight gain should ideally be assessed in the first trimester. As I say, not much weight gain is there. Primarily, the weight gain happens after the second trimester. So third trimester is the maximum time of weight gain. Second trimester comes next, and then is the minimum is in the first trimester. First trimester, every 4 weekly, mother can assess the weight gain. Hardly 3 to 4 kgs weight gain should be there in the first to second trimester. Then the maximum total, if we come to say the total weight gain in a pregnancy journey, it should be 9 to 11 kgs, ideal weight gain. Should be 9 to 11 kgs. If you are gaining less than 9 kgs, then you are undernourished. Then you need to have a lot of supplements. Okay. And if you're gaining more than 11 kg, then you need to check up your blood sugars, and maybe you are overeating, and overeating sugars in your diet. That should be then avoided. Third trimester is the main, third trimester is the main point of weight gain, where you gain maximum amount of weight from like 6 to 8 kgs and you gain in the third trimester itself.
As the baby grows, position matters.
Right.
As you approach the due date, as near as the due date, that's where mothers have a question on how can a mother identify that my baby is in the right position?
Okay, so the position of the baby, which we say normal, is the normal and is the right for normal delivery, is a cephalic position. So what does the term cephalic means? Cephalic means that is the head of the baby is downwards and the buttocks or the foot are upwards. So this is the normal position or a favorable position for the baby to deliver normally in a mother. So you yourself cannot examine, in case you are a layman, you cannot examine yourself that whether the baby is in normal position or not. That only your doctor can let you know whether the baby is in normal position or not, or your ultrasound. In case the ultrasound mentions the term cephalic, that means that the baby is in a normal position and it is favorable for normal delivery. So along with the normal delivery, along with the normal position of the baby, we also come to hear a term called as breech. So what a breech is? Next question might be that. So the breech means the buttocks of the baby is down and the head is upwards. So whenever the baby is in a breech position, you cannot deliver normally. Then you will have to go up for a cesarean delivery, because in that case, the complications along with the delivery process increases. The baby's head might get stuck up and the baby might have neurological complications in future. So that is it.
So I think that's what ulta paida hona means.
Yeah. So whenever we say that the baby is ulta, so that's what we mean, that the baby is in a breech position with the buttocks down. That means the buttocks will come out first in case of a normal delivery, followed by the head of the baby. So two more positions just to mention is that the baby can be in a transverse position also. Transverse means the head is towards one of the sides, either to the right or to the left of the mother, and the butts are to the other side. So in transverse, in case the baby is in a transverse position, then it is a strict no for a normal delivery and you have to go up for a cesarean section right away.
And what are the things, doctor, that derive this position? Is there what exactly are the, we can't say signs, but what exactly are the things which due to which the positions of the babies are in a certain way in which you have described it.
It's nature. Nature has devised its own way. Uterus is in a specific shape. It's in a pear shape. Why is it in a pear shape? It's in a pear shape just to hold the baby in the right position, because it's broad upwards, so the butts are broad and so that they can be kept up, and the head is narrow, so the head can be kept downward. So that is the shape of the uterus, and that is how it is favorable for a normal delivery. In case there are any malformations in the uterus, or we say there are any fibroids in Hindi term which we say rasoli, many women come to us that rasoli hai, to kya hamari normal delivery ho sakti hai? So yes, you can have a normal delivery in fibroid uterus, provided the baby is in the right position and the location of the fibroid is away from the cervix, away from the mouth of the uterus. Then
So I think in this we talked about the singleton pregnancy, when a mother is expecting a single child. What are the cases for a when a mother is expecting twins?
Yeah. So when it comes to twin pregnancy, there are two babies that the mother is carrying. So the position of both the babies matter in that case. In case both the babies are in a cephalic position, that is in a normal with the head down of both the babies, then we can give a trial of normal labor into that women. But in case one is cephalic, the other is breech, or the first is breech, the other is cephalic, then the risk of interlocking of the twins increases. That is, they can interlock, their hands can interlock or their heads can interlock while giving a trial of normal delivery. So in that case, we prefer a cesarean delivery in that case. Or any other position other than the first baby is in any other position like transverse or in breech or oblique lie also, then also we don't give a trial of normal delivery to that mother. We give directly opt for a cesarean delivery to be on a safe side. For sure, for both the mothers as well as for the baby.
These cues can definitely help the expecting mothers, new mothers feel more confident about what's coming for them in the future. So now we'll move towards the final leg of the journey, the delivery, the preparation of birth and what comes after that. So as we move towards the final weeks, that's where more anxiety starts kicking in. How will I handle the labor? How will I handle the delivery that's approaching in a few weeks or a month or something? That's where the mothers have questions which lead to how can she prepare her body, herself for what's coming ahead of her in terms of the delivery and also the childbirth later.
Yeah, so preparation of delivery starts right away the woman conceives. As I have said earlier also, exercises, prenatal exercises, yoga, help her in delivering the baby, in the relaxation of her ligaments, in muscles, relaxation of the muscles. Then next comes diet. A good amount of protein, a good amount of antioxidants, a good amount of iron in her diet helps in delivering her normally and increases the chances of normal delivery. Then when it comes to third trimester, it's the time when we start telling mothers about the various types of exercises which help her in delivering normally. These include mostly the Kegels exercises. Kegels exercises are a type of pelvic floor exercises. So squatting, duck walking are the type of exercises which help in relaxation of the perineal muscles and increasing the space in the lower pelvis to help the baby to come normally through the normal birth canal. Then nowadays what we are having are the Lamaze sessions. So Lamaze sessions, what do they do is that they help you prepare mentally. Meditation along with yoga, mental preparation along with physical preparation is the motive behind Lamaze sessions. So they help in preparing you mentally. Mental peace is utmost because you have to be prepared mentally for the labor pains, for the entire birth journey. You have to be prepared mentally. Along with that, physical preparation, which we teach through partner exercises. Partner exercises are a must. Ball exercises, duck walking. These all help in normal delivery of the fetus. Then what we say nowadays we have come up with the painless labor ideology. So what painless labor is, I give a just word on that also. So it is about the epidural anesthesia in which the woman is experiencing the contractions. The uterine contractions are there, but she's not experiencing the pain. So it helps in painless type of normal delivery because with contractions usually people feel pain. When there is no pain, along with the uterine contractions, the woman is mentally relaxed and then she will be able to contract the uterus and the dilatation of the cervical canal will be in a proper way and she'll be able to deliver normally and in a better way.
You mentioned Lamaze sessions.
Yeah.
What exactly can a mother expect from these sessions? And secondly, when these sessions begin?
Yeah, so sessions can be taken up right away from the second trimester, because starting with the yoga and meditation, because they give education about what you will be going through while you will be undergoing the delivery process, because it's not just a few hours process. In the first delivery might take more than 24 hours also sometimes for the delivery to happen. So it's a like you have to be patient before you can go up for a delivery process. And definitely it's a partner session. It's never the mom only. The husband also has to take part equally while preparation of the baby.
What are some common exercises in terms of partner exercises that you guys involved?
Whenever we go to the gym, we usually see a big ball. So ball exercises, they help the women is sitting on the ball and the partner is holding her hand, and then they have to just roll on the ball. The ball exercises help on in improving the power of the pelvic floor muscles and in pushing out the baby and giving space, adequate amount of space to the baby to come out through that normal birth canal. Then comes the duck walking. So the duck walk, a mother cannot do alone. Someone has to be there to hold her hand firmly. So that is another partner exercises. Then is the butterfly. You sit down and then you open up your legs and you do butterfly wings like this. They help in increasing the space. All these exercises, they help in relaxation of the ligaments, relaxation of the perineal muscles, and to increase the birth canal space, so that the baby can come out easily through that.
And now when the mother has made it through the delivery, what a whirlwind that she has been through, whether it's a C-section or a normal delivery, the body needs its own time to heal. That's where the question arises: how much time does it take for the body to recover either from the normal delivery or from the C-section?
So normally it takes 6 to 8 weeks for a female to recover completely from a normal delivery or from a cesarean section. Whenever the woman has normal delivery, the recovery is usually faster, because she gets to eat a lot immediately post delivery. But that could not be possible after a cesarean delivery for sure, because she has undergone an operation. So usually like in the first day though, we give only liquids to the women. Then subsequently we increase the diet. The most important for the recovery of a woman after delivery, no matter what the mode is, normal or cesarean, is the high protein diet. So when I delivered my baby, so take it for an example, when I delivered my baby, my mother-in-law used to say, beta, ghee zyada khao, ghee zyada khao, ghee zyada khao. But now it's not that. No, we should have a high protein diet, not only carbohydrate. Protein is a must for proper healing of the stitches, because in a normal delivery also we have stitches, and in cesarean also we have stitches. In normal delivery, perineal stitches are there. In cesarean, no, abdominal stitches are there. So for healing, protein is a must. Carbohydrate, yes, definitely is a must, because the calorie intake of the mother increases, because she is breastfeeding now. The calorie intake increases definitely, so carbohydrate is a must, but not that it should be only carbohydrate based. It should have proteins as well. Proteins we can give in form of supplements, in the form of lentils. In case you're non-vegetarian, then meat you can have eggs, you can have a lot. Along with that, a balanced diet is a must. It should include all the vitamins, minerals, folic acid as well for proper healing, along with calcium. Calcium, because it helps in bringing milk. So whenever we say that you are recovering from a normal delivery or a cesarean delivery, it's after 6 to 8 weeks, when the uterus has gone to its normal size, then you can start exercising and gymming. Only after that you can start exercising, because prior to that the uterus is still an abdominal organ. It is still in the abdomen. It has not gone inside the bony pelvis. So once it goes inside, only then you should start gymming and exercising.
As you said earlier that a mother eats a lot.
Yeah.
Post specifically in the normal delivery. So a mother is actually asked to eat n number of things, which are some homemade, some have a lot of ghee, some have a lot of butter in it.
Yeah.
So carbohydrates to a limit is acceptable, as we saw. So in case of a normal delivery, what exactly should be the eating habits for the at least first 40 days? That is recommended by a gynecologist or an obstetrician that they recommend.
So nowadays we give a proper diet plan to the delivered mother by a dietitian. By a dietitian, she gives an entire list what she should have in the morning, then snacks, then afternoon, then post afternoon snacks, and then dinner. So the most important thing is that nothing should be over. Neither carbohydrates nor proteins nor minerals. Everything should be in a balanced way. You should have milk 3 to 4 times in a day. You should have your supplements also along with that. You should have in the morning a bit of protein like a chila you can have. You can have upma. Then in lunch you can have chapatis, dal, roti, rice also you can have. There are some restrictions definitely. If the mother is diabetic, then you should avoid rice, and you should avoid excessive amount of sugars in your food. Then what our mothers and our mother-in-law give to us when we deliver the babies is something which is anjeer or goond ke laddu. Why do they give anjeer or goond ke laddu? Is that they help the mother to express milk. So these are all lactogogues. Lactogogues is the term which we use for increasing the milk production in the mother, so that she can have adequate amount of milk supply for the baby. Otherwise, the baby will have to be fed formula feed, not just the breast milk, in case she does not have adequate amount of breast milk supply.
You also mentioned milk consumption 3 to 4 times a day in the first 40 days. So I've seen a lot of young mothers these days, they are completely averse. Some are, of course, lactose intolerant, etc. But milk as a consumption commodity gives them bloating, etc. This is something where the body doesn't take because they have not been used to from quite a long time in their life. So what exactly replaces it? What could be the best practices?
So for those women who are lactose intolerant, nowadays lactose-free milk is available. In case they have excessive bloating or they don't want to have milk, then modified form of milk they can have, like in the form of curd, chaach, paneer, other milk products. Then they can have. Our idea is just to give adequate amount of calcium to their body, because their bones are being used up for making milk, because milk is a source of calcium which their body is producing. So we have to give them adequate amount of calcium supplements in the form of diet, in the form of medicine.
So this was all about recovering in the first 6 to 8 weeks post-pregnancy. Now the next phase that a working woman or a working mother has to take up is when to start working. That's where the question arises, with the body still healing, the baby demanding a lot of extra time, additional hours for the take care, at least in the first 6 months or 1 year at least. What is the right time, according to you, doctor, where the mother can actually start working or start taking up additional responsibility of work on her?
So 4 to 6 weeks is the minimum time which woman's body will need to recover completely. After 4 to 6 weeks, she can initially opt for work from home in case she is working woman in a corporate setup, or in case she has to go, then after 6 weeks definitely, because after 6 weeks only her body will be in a normal position and in the normal contour back to the previous one.
Thank you so much, Dr. Prerna, for being with us here. This was an extremely enriching session for our audience. I hope a lot of doubts on your questions about the first, second and third trimesters of the pregnancy got cleared. For more such sessions, please follow us on Instagram and YouTube.
So thank you, audience, for watching this video. I hope I could make your doubts better for the future, and for the moms to carry their pregnancy along in a better way, and to have a delivery and a wonderful future ahead. And in case you have any more queries, feel free to contact us, and looking forward to more sessions with your new queries. Thank you.